Brett's talked about mentors, and actually Brett was my mentor for sustainability, so it's kind of nice to pass it on to me. I haven't got a baby photo, but I guess this photo of me, Brett, and Paul Ashley, who we work with a lot, I'm sort of a sustainability baby in that photo. So I kind of got involved by accident through a Twitter exchange between Brett and Paul about the sustainability of toothbrushes. And again, as Brett said, we started doing a life cycle assessment, really not knowing what we were doing, partnering with Sophie, who's pictured again there. And it's really nice for your students to work with non-dental students, and it was a really nice partnership with Sophie. So she brought the kind of LCA knowledge side, and we brought the sort of clinical expertise side. And it took us about a year, but we think we kind of bottomed out toothbrushes, so we figured out, okay, which toothbrushes are most sustainable, but what's the evidence for electric versus manual toothbrushes, and how do we combine the two so we get the best patient benefit but the best planet benefit? And that sort of snowballed. So I don't mean this slide to be like a brag, but once we finished an LCA, we had about 5 ideas for new LCAs. Each of those LCAs generated ideas for 5 new projects. And Brett and I went through a period of a few years of just publishing LCAs to the point where we're now, Brett, you're top 3, I'm top 10. And this is mad because I'm not an academic. I was a clinical trainee at the time at the NHS. I have no academic funding at all. So you really don't have to have any specialist knowledge just to start doing this, figure it out, and before you know it, you're in the top 10 publishers in the world. So what I want to talk about more is supervising sustainability projects. So I don't do so much of the kind of big level leadership that Brett does, but I do have a little cohort of students who now do all my projects for me. So I just want to talk about how we've put sustainability into their projects. And some of this is like formal research, some of it is our kind of clinical trainees. So how we've embedded it in different ways for our students. So firstly, this is Sarah. She's finishing up her 3-year doctorate at UCL at the moment. And this is an example of kind of her entire research project has been on sustainability. It's been on a really specific area, which is nitrous oxide in paediatric dentistry. I'm a paediatric dentist. And here she is presenting sort of part of her work at the British Society of Paediatric Dentistry. So she's done an entire 3-year project just on nitrous oxide, the environmental impact of nitrous oxide, and that's cutting a lot of stuff out. So you think that's a really specific project, but actually it's taken 3 years and there's still loads more we could do. So that, again, that's spiraling into more and more stuff. So that's a kind of formal way to have an entire project that's just about sustainability. But the next 3 projects are very different. So Dia, she was 2 years post-qualification. She was doing a kind of clinical placement at the Eastman, which is where I work. And we were experimenting at the time with video clinics for one of our MDTs. And she did a kind of arm of this quality improvement. So she looked at the environmental impact of a video appointment versus a face-to-face appointment on our MDT clinic. And we had other trainees doing things like patient satisfaction and clinical outcomes, etc. So sustainability was like one arm of this big quality improvement project. And now this is our orthodontic pediatric dentistry MDT. It's almost entirely virtual now. And again, Dia was presenting it at one of our conferences. So it's a really nice kind of project for new dentists coming through to get things on their CV and get projects out there. This one was 2 dentists came to me after I gave a lecture in London to their kind of foundation training scheme. So they're all 1 year out of university. And I gave a lecture on sustainability projects and how to get started. And they came and found me afterwards. And they had an idea. They'd noticed kind of between themselves, they'd all been chatting about the single-use plastics that they use in their dental practices. And they noticed like a huge variety between what different practices were using. And they kind of wanted to design a little project around that. And they did a really nice kind of carbon footprint calculation, did a survey of their local dental practices, did a cost calculation. And it was a really nice kind of quality improvement project, which again, they got published. And that's really nice for them in their first year out of training to kind of get that exposure. And then finally, Hassan, again, he was doing a 3-year doctorate, nothing to do with sustainability, but he noticed during his placement with us that we were using different types of gloves in theatre versus on clinic, but for the same procedures. And he thought that was very wasteful. We agreed. So he did a life cycle assessment on that. And he published the life cycle assessment separately as like a little piece of research. But really, it helped develop his leadership skills. He had to liaise with infection control. He had to liaise with other specialties in our division to kind of make this clinical change in our dental hospital. And I think we're quite proud of Hassan because he's gone back now to Saudi Arabia. He's established a kind of all healthcare sustainability initiative there, and he works with FDI. So a really small project during his doctorate has now kind of snowballed into his career and was actually quite a main aspect of his career. So we're really proud of Hassan. So that's me bigging up my students. But I sat down with them and we had a chat about what it was like doing their first projects in sustainability and coming into it not knowing anything about sustainability. So hopefully you'll see a few of their kind of reflections here.
That once you get the grips of it, there's not too much to it, and you can apply it of parts of your clinical practice or academic practice
to calculate carbon footprint, because I thought that was going to be really complicated, but there's like a stat formula, and if you put the things in it, it just brings out an answer. So that made things much easier because I was expecting that to be a real challenge.
It also gave me a better idea on how to actually make a difference. Small changes can actually make a huge difference at the end.
Yes. That you can kind of see a comparison side by side of like, this is the same as taking X amount of flights in a year, and when you see things put down that simply, it kind of is really obvious what we should be doing.
I'm more aware of the impact I'm having personally in the practices, so I can sort of comment on, or maybe we don't need to do X, Y, Z.
But I also kind of used that to partake in other projects whilst I was an associate dentist. So
but I'm more aware there's a huge tray of plastic 3-in-1 tips, and I know kind of what the impact of it.
It gave me more confidence in carrying out a similar project back home that I couldn't do back there.
Like structure things in such a way that you kind of like learn along the way.
The main things was being quite open to the questions we had, because I felt like a lot of our questions were really simple.
A really good way to help initially would be to have like a sit-down meeting like we did with you, just a Zoom call, and come up with a framework together.
So I think provide enough guidance and time to the trainers.
Nice. So that was my very cut-down version of what was probably about a half an hour reflection with each of those students. So I've kind of summarised the kind of main tips and things they wanted to feedback and the advice they wanted to give to anyone else who was going to start this. And I put them up on the board here, but you can see they're not necessarily specific to sustainability. It's kind of all the things that the student would want from any project. The only one I'd want to kind of highlight is number 3. You remember Brett put up a slide of our toothbrush diagram with all the different things that go into making and using and disposing of the toothbrush. It's really good to get peer review at that point. It's so easy to piss something off that diagram. And if you start your data collection and then you have to kind of go back and change it, that's quite a problem. So have like a big peer review early on with people outside the project to come in and give an opinion. Are we including the right things? Is that how you use that product? What do we think? That would be my kind of one sustainability specific thing, whether you're doing a carbon footprint or a full-blown life cycle assessment to get peer review early on. So that's kind of my tips, and hopefully what me and Brett have said is that everyone in this room can go away now and start a sustainability project. You literally don't need any extra training. I knew nothing about what I was doing, still maybe don't. So hopefully all of you will maybe go away and think of ideas for projects. And if you do have any ideas, come and find me and Brett afterwards and let's talk them through and get you all started. That's what we want.